Are fasting and non-fasting lipid profiles different? Let's dive into the question of whether fasting and non-fasting lipid profiles yield different results. A lipid profile is a blood test that measures cholesterol and triglycerides. These are important markers for heart disease risk, especially for those with high levels of fats in the blood, known as hyperlipidemia. Traditionally, doctors recommended fasting for 8 to 12 hours before the test. The reasoning was that eating could temporarily raise triglyceride levels, which might affect the test's accuracy. However, recent research has brought new insights. Current evidence indicates that for most adults, non-fasting lipid profiles provide results for total cholesterol and high-density lipoprotein, often referred to as good cholesterol, that are very similar to those obtained from fasting tests. The difference in total cholesterol between fasting and non-fasting samples is usually minimal, typically less than 0.2 millimoles per liter, or about 8 milligrams per deciliter. This means that for routine screening, especially in individuals without known lipid disorders, a non-fasting test can be just as informative for these two measures. On the other hand, triglycerides can be more influenced by recent food intake. After eating, triglyceride levels may rise temporarily. This could affect how doctors interpret your risk, especially if your triglycerides are already borderline or high. If a non-fasting lipid profile shows elevated triglycerides, your doctor might suggest a follow-up test after fasting to confirm the results. For individuals with hyperlipidemia, having accurate lipid measurements is crucial for guiding treatment decisions. If you are primarily monitoring total cholesterol or high-density lipoprotein, a non-fasting test is generally adequate. However, if you have a history of high triglycerides, or if your non-fasting test shows elevated levels, a fasting lipid profile may be necessary for a clearer understanding. It's also essential to avoid alcohol before a lipid test, as it can significantly alter results. Major health organizations now recognize that non-fasting lipid profiles are acceptable for most adults. This change simplifies the testing process and makes it easier for people to get screened. Studies have shown that non-fasting lipid levels are strong predictors of cardiovascular risk. In summary, for most people, non-fasting lipid profiles provide reliable information about total cholesterol and high-density lipoprotein, with minimal differences from fasting tests. However, triglyceride levels can be affected by recent meals, so fasting may still be recommended if triglycerides are a concern. Individuals with hyperlipidemia should follow their healthcare provider's advice regarding fasting before testing. Always remember to avoid alcohol prior to a lipid test to ensure accurate results.